Hi, I'm Seth Phillips, physical therapist at the Center for Physical Rehabilitation. And today I wanted to talk to you a little bit about dry needling and its usefulness in treating musculoskeletal related pain. We all experience muscular related pain throughout our lives intermittently, and typically this pain will resolve over time without any specific intervention. However, if it becomes chronic, it can significantly limit your function and your lifestyle. This is where a physical therapist may come into play. There are various treatment avenues that we might use in physical therapy to treat these muscular related disorders. And one of them is through manual therapy, which includes soft tissue mobilization, which is massage-based techniques utilizing our hands and or a tool like this. We've all had sore areas that respond well to rubbing, whether we rub it ourselves or whether we have someone else rub that sore muscle. It tends to decrease the pain. Some of the thoughts behind why this is beneficial are that rubbing the area will help improve or stimulate blood flow, which brings oxygenated and nutrient-rich blood to the area, while also removing the metabolic waste from the area and toxins to promote a more healthy environment for healing. Another thought is that by stimulating the muscle and the associated nerves to that muscle, that we can inhibit pain and decrease spasming and trigger points in the muscle area itself. One of the limitations of using these manual therapy techniques is that we have to palpate through superficial layers to get to the muscle in question, including skin, adipose or fat tissue, as well as any superficial muscles that may lie over the muscle in question. Through the use of a needle, we can penetrate through this superficial tissue and directly access the muscle that is in a dysfunctional pattern. It has also been found that by placing a needle into the muscle itself, we can change it on a biochemical cellular level to help further inhibit pain, spasming, trigger points within that muscle and allow it to contract and move normally, and thereby improving its function and decreasing associated pain. Most areas of the body can be safely dry needled. For demonstration purposes, I will dry needle the hand. So with a typical dry needling session, we will cleanse the area with alcohol, cleanse our hands with alcohol, and then choose a needle. They come in various lengths, depending on the depth of the tissue that we are treating. We then palpate the area, looking for the areas of increased pain or trigger points, and those areas respond best to dry needling and decreasing pain in the muscle. We then apply some pressure and give a direct tap to the needle, and then direct the needle to the depth of tissue we are treating. Oftentimes we will utilize E-stim directly to the needle, which further enhances the needling session by activating the muscle, helping it contract, which helps decrease pain as well as improving the motor control and function of the muscle itself. Dry needling can be beneficial to the active athlete training and recovering between training sessions, to the grandma or grandpa who just wants to be able to play with their grandchild. If you'd like to find out if dry needling will be of benefit to you, please contact us.